Good afternoon. Welcome to this afternoon's Committee on Health and Human Services. Secretary, will you please call roll?
Assembly members Dahlia, Edgeworth, Gonzalez, Goulding, Gray, Hafen, Hibbets, Hunt, Jackson, Koenig, Nadeem, Wynn, Orentlicker, Chair Brown May.
Thank you. Would you please mark our members present as they arrive? We do have quorum. Today we have a number of items on our agenda. First, some housekeeping items as we begin. Please remember to silence your electronic devices. If you wish to testify today, please sign in at the table. When testifying, please make sure to turn on the microphone and then clearly state and spell your name for the record. If you would like to provide public comment on the telephone or testimony on a bill, please do so by calling 888-475-4499, and then today's meeting ID is 837-2492-8289. I will repeat that again as we get closer to that portion of our meeting. Meeting agenda and committee information is available as always on Nellis. Public comment will be taken at the end of our meeting today. And as a reminder, we expect courtesy and respect in all of our interactions. If you are testifying in support, opposition, or neutral on a bill, we'll ask you to make sure that you stay with the issues that are germane to that bill. Please note our committee members will be using our laptops, so please don't take that as a sign of disrespect. They have a lot of items to look at online. Today, before we begin our posted agenda, members, we do have some bill draft requests to introduce. So first BDR introduction is 38809, which is an act relating to Medicaid requiring the state plan for Medicaid to provide coverage for certain services relating to family planning, language translation, and providing other matters properly related thereto.
So moved. Second.
I have a motion to introduce this bill by Assemblyman Wynn and a second by Assemblyman Gray. Is there any discussion on the motion? All those in favor, please say aye.
Aye.
Any opposed? Hearing none, motion passes. Thank you. Next, we have BDR introduction 40-354, which is an act relating to healthcare requiring certain agencies and licensing boards to establish a process for the priority review of certain applications for licensure to practice a health profession and providing other matters properly related thereto.
So moved.
A motion to approve by Assemblyman Wynn, second by Assemblyman Gray. Any discussion on the motion? Seeing none, all those in favor say aye.
Aye.
Any opposed? Hearing none, motion passes. Thank you. And third, BDR introduction 40-806, which relates to healthcare, revising the data that is collected concerning providers of healthcare in this state and providing other matters properly related thereto.
So moved.
Motion by Assemblyman Wynn, second by Assemblyman Gray. Any discussion on the motion? Hearing none, all those in favor, please say aye.
Say aye.
Any opposed? Hearing none, motion passes. Thank you, members, very much for that. Okay, let's move on to our posted agenda. And we will officially open the bill hearing for Assembly Bill 343, which makes revisions relating to healthcare. We will welcome our speaker and our guest to the table. Mr. Volk, thank you so much for joining us. As a reminder, we will ask each of our presenters to maintain 15 minutes for your presentation, if you would kindly, and then we will also time limit support, opposition, and neutral testimony on each of our bills today to 20 minutes, just so that we have an opportunity to get through all of our measures. So, Mr. Speaker, welcome to the Committee on Health and Human Services today. We're happy to have you.
Well, good afternoon, Chair Brown May, Vice Chair Wynn, members of the Health and Human Services Committee. Before I start, let me just thank you all for your service to the legislature. I used to serve on this committee once back in the day, and I know how tough it is and how many issues that you work on, so let me thank you for that. My name is Steve Yeager. I represent Assembly District 9 in Southwest Las Vegas, and it is an honor to present Assembly Bill 343 to you this afternoon. With me at the table to my left is Taylor Volk. You might remember him. He was introduced on the floor not too long ago. He is one of the Assembly Leadership Office interns this session. After my remarks, he's going to provide an overview of the bill. But before I continue, I did want to just introduce him briefly so you know. He is a senior at UNLV, and while getting experience here in this building, he's also working for Brookings Mountain West. His interests lie in public policy, and he has taken an interest in both health and substance abuse policy. After graduating with his bachelor's in political science, his focus is working on towards getting his JD or MPA. So he's got some work ahead of him, and I'm honored that he's joining me here at the table this afternoon. In addition to Mr. Volk, on Zoom, you can see we have two former legislators from the state of Colorado. They worked on this legislation, this version of legislation in Colorado. They worked on it together. We have Stephen Fenberg, who is the former Democratic president of the Colorado Senate, and we have Patrick Neville, former Republican leader in the Colorado House. So we had a bipartisan group there, and we hope this will be bipartisan as well. So they are mainly here to answer questions when we're done with the presentation. So on to Assembly Bill 343. Assembly Bill 343 is a critical piece of legislation that will bring much-needed transparency to healthcare pricing in Nevada and ensure that patients have the information they need to make informed decisions about their medical care. Healthcare is one of the most significant expenses for Nevada families, yet too often, patients are left in the dark about the true cost of their care until they receive a bill in the mail. That's not how a fair and functioning market should operate. Assembly Bill 343 seeks to change this by codifying existing federal transparency requirements into state law, giving Nevada patients the ability to compare hospital prices just as they would for any other major purchase. In 2019, which seems like a lifetime ago, President Trump issued an executive order that laid the foundation for healthcare price transparency nationwide. His administration's CMS rules required hospitals to post their pricing for shoppable services and mandated that health plans disclose negotiated rates with providers. These requirements were enforceable as of July 1, 2022. However, compliance across the country has been slow, and Nevada is no exception. According to the Patient Rights Advocate's most recent analysis, only 35% of Nevada hospitals are currently in full compliance with the federal price transparency law. That means a significant number of patients in our state still do not have access to the clear, upfront pricing information that federal law requires. This is not acceptable. We cannot allow hospitals to continue operating under a system that leaves consumers guessing about what their health care will cost. Now, just last month, on Tuesday, February 25th, 2025, President Trump signed a new executive order to reinforce the rules and increase enforcement. Now, it's our turn to do our job at the state level and require hospital price transparency in state law and empower Nevadans to protect their rights to be an informed consumer. AB 343 is relatively straightforward, and it's a necessary solution. The bill does three key things that I'll go through at a high level. Number one, it codifies federal transparency requirements into state law. It ensures that Nevada hospitals comply with the same standards mandated at the federal level, reinforcing accountability at the state level. It also requires hospitals to file annual reports with Nevada Department of Health and Human Services, which will ensure ongoing compliance. That was number one. Number two, it prohibits hospitals from collecting medical debt if they fail to comply. Patients should not be on the hook for medical bills when hospitals have failed to provide clear pricing information up front. If a hospital does not comply with these transparency rules, AB 343 will prevent them from pursuing medical debt collection. Additionally, patients will have the ability to bring a civil action to stop debt collection in cases of noncompliance. That was number two. Number three, this legislation empowers the state to enforce compliance. Without enforcement, let's be honest, transparency laws are pretty meaningless. AB 343 allows the state to take civil action against hospitals that refuse to comply, ensuring that all Nevada healthcare consumers have access to the pricing information they deserve. Transparency in healthcare pricing is not a partisan issue. It's a common sense reform that benefits every Nevadan. We've already seen strong bipartisan support for similar laws in other states. We've mentioned Colorado. Ohio recently passed this law, with unanimous support from the legislature and signed into law by Republican Governor Mike DeWine. Several other states, both of the blue and red varieties, including New Mexico, Wyoming, Oklahoma, Kentucky, Oregon, Washington, Illinois, Pennsylvania, Hawaii, Michigan, Indiana, and Iowa, are all currently considering this legislation in 2025. By passing AB 343, we are aligning Nevada with this growing bipartisan movement and ensuring that our state stands up for patients, not opaque hospital billing practices. This bill is about fairness, accountability, and empowering patients to make informed choices about their health care. Every business in America is required to disclose pricing up front. Hospitals should not be an exception. I urge this committee to support AB 343 and join this national effort to make healthcare costs transparent for all Nevada patients. And now, Chair, with your permission, I'm going to turn it over to Mr. Volk, who will give you a very quick walkthrough of the bill.
Thank you. Go ahead.
Hi, my name is Taylor Volk. That's Taylorvolk for the record. Thank you, Mr. Speaker, for bringing this bill forward. Hello, Madam Chair, Vice Chair, and members of this committee. Today I'll be walking you through sections for AB 343. All right. Sections 1 through 12 of this bill include definitions and scope of the legislation. Sections 13 through 16 codify federal price transparency rules and establish a system of annual reporting requirements. These sections incorporate federal price transparency requirements into Nevada law. Hospitals are required to post a machine-readable file with a standard charge for all items and services, provide a consumer-friendly display of at least 300 shoppable services, submit annual reports to the Nevada Department of Health and Human Services confirming compliance. These reports must confirm compliance with transparency laws and detail efforts to provide pricing information. Non-compliant hospitals must submit a corrective action plan. Now, Section 17 prohibits hospitals from engaging in medical debt collection if they are non-compliant with price transparency requirements. Patients can use non-compliance as a legal defense in medical debt lawsuits. It ensures that consumers are not penalized for hospitals failing to follow transparency laws. And it grants consumers the right to bring civil lawsuits against hospitals that fail to comply. It also allows courts to issue injunctions to stop non-compliant hospitals from collecting medical debt, providing a direct avenue for patients to hold hospitals accountable. Sections 18 through 21, it gives the Nevada Attorney General's Office and the Department of Health and Human Services authority to take legal action against non-compliant hospitals. It establishes penalties for hospitals that fail to meet transparency requirements. It ensures that Nevada can enforce compliance independently of federal agencies. It requires DHHS to maintain a list of outcomes from non-compliant compliant investigations. Now, the last section, Section 22, it requires hospitals to provide an itemized receipt and associated information to patients. Thank you.
Chair, this is Steve Yeager. That is the entirety of our presentation. We have our two folks joining us from Colorado on Zoom for the purposes of helping to answer questions as they've been through this process before. So with your permission, Madam Chair, we'd be open to answering any questions on Assembly Bill 343.
Thank you. Thank you for the presentation. Members, are there any questions? Yes, Assemblymember Goulding.
Thank you, Chair. Thank you for the presentation. I might have missed this in the depth of the bill, but can you define incident? Is that per day? What exactly is incident on page 12?
Chair, with your permission, I think I'm going to, Steve Yeager for the record, if you don't mind me defaulting to our folks on Zoom who are the experts, if I don't know if one of them would like to answer Mr. Fenberg or Mr. Neville, please.
Thank you. Please go ahead.
Hi, Patrick Neville here. I'll go ahead and answer that. So there is some leeway within the bill itself.
I'm sorry.
It allows the
Before you
department some
begin,
discretion
would you state and spell your name for the record just so that we can record that for our secretaries?
Yes, absolutely. Apologies. Patrick Neville, that's Patrick. Last name is Neville, Neville.
Thank you, Mr. Neville. Go ahead.
Okay, thank you. So per incident is essentially, it could be a per day thing, but that's after there's the process where the department gives them 30 days to come into compliance, has them do a corrective action plan. This is different than some states like Colorado specifically. I will refer to that is we didn't have that much leeway within our bill. And I think this bill is actually done better than what Colorado has done because we didn't actually give the hospitals time to work with the department to come into compliance first. So this is actually, I think, a softer measure than what we currently have in Colorado. Colorado, it is done through the Attorney General's office, and it can be a $10,000 per day per individual penalty without the ability to actually have that ability to come into compliance and work with the department prior to. And so this is after all that's done, if they're still not in compliance, then the department may issue a fine up to that amount, but still has discretion within that. And then if they're still not in compliance after that, that's when the incidents start kicking in each time after. And so there's some discretion within the department as well.
Thank you. Our next question is from Assemblymember Ornlicker.
Thank you, Chair. Thank you for the presentation. As you indicated, the bill codifies the Federal Transparency Act. If the Federal Transparency Act is changed, maybe strengthened, might be weakened, would we have to come back if we thought they made some good changes in the federal law? Would we come back, or is there some provision here to update?
Steve Yeager, for the record, I can go ahead and take that one. That's a good question, and one that we deal with quite often when we're trying to figure out, codifying federal law. There's nothing in this bill that would automatically incorporate updating federal law. So I think we or another legislature would have the option to come back. If they felt like the federal government did something better, we could always come back and amend it. Obviously, if the federal government decided to get rid of the law, which I don't think they're going to, given that the president who signed the order in the first place is still the president today. But if they did, this would still continue to exist in state law. So that would really be up to a future legislature to decide what to do on that front.
And this is Steve Fenberg, just to chime in. It's STEVEFENBERG. Thank you, Assemblymember, for the question. Agree with everything the speaker said, and also we feel very confident that there's nothing in this law, in the Nevada law, that would conflict with federal regulation or federal law that would happen in the future. So we feel like they would be complementary. And so if Nevada wanted to do something and tweak it and reflect something that's in the federal law, that would obviously be fine. But we don't think there's a risk of being in conflict with what the federal requirements are, which is important because then that means a hospital only needs to follow the Nevada requirements, and they're automatically then going to be following the federal ones as well, and they won't have to do it twice.
Thank you. Next question from Assemblymember Nadeem.
Thank you so much, Madam Chair. Thank you so much for the presentation. Thank you for bringing this issue. It's such an important issue for the fellow Nevadans. So my question is that, Bill, this thing goes, the price evaluation, that goes for the hospital inpatient or the outside? There's some facilities sometimes the hospitals have outside the hospital, like sometimes they have the urgent care. So this price thing, it goes for them too?
Chair Steve Yeager, I would pass that up to maybe Mr. Fenberg would be good to answer that one. Thank you, Chair.
Thank you, Mr. Speaker. Thank you, Chair Steve Fenberg, for the record. The bill applies to the same entities that the federal requirements apply to. So it doesn't expand the scope to which types of entities it would apply to, which again, I think is important to have that consistency with federal regulations. My understanding is that it would apply to anything that is licensed as a hospital within state law. So I believe Nevada licenses urgent cares as separate types of entities, as an urgent care, not as a hospital. So in that scenario, this law would not apply to them, only for licensed hospitals in the state.
Okay, thank you.
Thank you. Next is Assemblymember Gray.
Thank you, Madam Chair. 300 shoppable items there, Speaker. Who would choose those items? Will it be like a menu for different hospitals, or will they be set forth in regulation? What are your thoughts on that? I mean, if we're going to compare apples to apples and oranges to oranges, just wondering how, if it's going to be uniform.
Chair, I feel like a broken record. Steve Yeager. I'm going to pass that up there to hear what the experience was in other states and how that was determined. I think it is like the 300 most popular items, but would love for the folks who have done this out in the field to weigh in.
Thank you, Mr. Speaker. Steve Femberg for the record. Thank you, Madam Chair. Thank you for the question. So the 300 shoppable list is also described in federal requirements. So it is the same type of regulation that would exist at the federal level as in Nevada state law if this bill passes. And the way it's determined is the CMS, or the federal regulator, actually determines what 70 of those 300 shoppable services have to be. And then it's up to the hospital to choose the remainder. And the bill provides guidance on how to choose the remainder, and it's based on the most commonly used procedures or services for that hospital. So we think, generally speaking, it's going to be a very similar list, if almost identical across hospitals. But the point is that the purpose is so a consumer, when they go to the website, more likely than not, the service that they're going to be going to that hospital for is going to be in that list of 300 services, which again are going to be 70 that are determined by CMS, and then the rest are going to be based on what the hospital most commonly is doing based on the number of procedures that they do.
Members, any other questions? Thank you. Speaker, I have a question. Actually, a couple, if you will indulge. I'm curious to know, Section 15, Sub 3, on page 7 of the bill identifies that a hospital shall not remove any version of a list that's published pursuant to this section from their internet website until 7 years after the date. I'm just curious to know the practicality of that and what we're seeing in other states. How often does the list get updated, and does it become then confusing for folks who are looking to shop the list?
Mr. Speaker, do you want me to field that?
Yes, please.
Thanks. Thank you, Madam Chair. Steve Femberg for the record. So the purpose here is because, to answer your last question first, I suppose, the federal requirements require that a hospital updates their list on their website at least once a year. What we are doing in this bill is slightly different. It's one of the very few areas where it departs a little bit, because we've found that it's very important that when a consumer goes to a hospital's website, that they're actually getting accurate information, not outdated information. So we do specify in this bill that if they make major changes in their pricing, that they should provide that update on their website prior to a whole year potentially going by. The reason why the bill specifies that they should keep the most recent, the previous versions of the file as well is because oftentimes you'll go in, you'll get a surgery or a procedure, you'll get a bill sometimes months later. I think we've all experienced that. And then when you're finally having to pay the bill after maybe negotiations happened with insurance and different facilities and all of that, there's a chance that in that time period, the pricing changed. And so we want to make sure when a consumer goes to the website and says, well, it looks like for this procedure, I was charged X dollars, but the file says Y dollars. We want to make sure that they're looking at what the price was on the date of their procedure. And that's why it's important to keep historical prices on there as well as the current ones, because you're often kind of dealing with your medical bills many months, if not years, sometimes after a procedure occurs.
Thank you for that explanation. I have a question from Vice Chair Nguyen.
Thank you, Madam Chair, and thank you, Speaker. I just wanted to get a little bit of explanation on page 10, and of course, the phone a friend folks would be the one to answer. The page 10, line 30. Should have brought my glasses. I forgot. On line 31, and from 29 to 32, it talks about the consumer reporting agencies and the ability to have them either take off from the record or not including this particular dispute in the report. I'm wondering if that language right there is strong enough, because sometimes credit agencies are pretty hard to deal with in terms of removal of any types of debt dispute, and that stay on record for the consumer for sometimes years to take it off. So in terms of this particular language, is refrained a strong enough word? I guess I'm just curious on that part. Perhaps the folks on the phone can address that.
Thank you, Madam Chair. Steve Femberg for the record. Thank you for the question. I think it's a good question. We probably were hesitant to go into too much detail in dictating exactly how consumer reports and collection agencies are managed, just because it is a slightly different area of law. But we would definitely be open to further conversations on strengthening or clarifying that section. But from what we've seen in other states, at least, we feel that this language is sufficient to getting the goal done. Which really the goal is, if you're charged or if you're sent to collections and it's determined later that you were sent to collections incorrectly, that it doesn't obviously hurt your credit rating. It's not showing up on your reports. But we'd be open to further conversations offline or later on to figure out how to clarify that or make sure it's strengthened and meets that goal.
Quick follow-up, Chair. Thank you very much. Thank you for that. And Mr. Speaker, I just want to make sure that, my intention is ensuring that we help folks who have had such a dramatic experience, because they already dealt with that. And of course, some of these consumer reports stay on record if you had bad debt, anywhere up to 7 or 11 years, depends on what that debt is. And sometimes even $5 could haunt you for many years. And that would be a detriment to an average family who has issues with, buying a car or buying a house, or even, obtaining a credit application just because of a $5 debt.
And Madam Speaker, if I may, Steve Femberg for the record, just to follow up on that comment, I think that's absolutely correct and incredibly important. A lot of times when families find themselves into debt, it is medical debt, and obviously that it just piles on to the problem if that then keeps them from getting jobs or getting credit, et cetera, later down the road. But I will just say the other thing I would like to look into and have this conversation further with you, if interested, is I believe there have been some federal regulations, and I know there have been some actions at state level, and I don't know about Nevada exactly, that actually medical debt isn't allowed to show up on some credit reports. Other types of debt can. But so I would just want to make sure that whatever we would do or however we would clarify or strengthen the section, that it's complementary to those other efforts that I think have happened recently at the federal level.
Thank you. I believe we have a follow-up question from Assemblymember Nadeem.
Thank you so much, Madam Chair. So my question is regarding, thank you so much, the price determination is such a great idea, and that's going to help the people of Nevada. My question is, the price determination, is it going to be according to the Medicaid rates or Medicare rates? Is there any information on that? Thank you.
Thank you, Madam Chair. Steve Femberg for the record. If I'm understanding the question correctly, so the file that will be displayed or that one could find on a hospital's website, it's actually going to have multiple data points in it. It's going to have the highest negotiated rate and the lowest negotiated rate. It's going to have the charge master as well as the out-of-pocket sort of cash payer rate. Because as we know, pricing for medical care is very complicated. It makes many Americans' heads spin when they get a bill. And unfortunately, that means the transparency data is also complicated. But long story short, the idea is that no matter who your insurance is, or if you're paying cash versus you're paying through an insurer, that when you look at this file, you'll be able to find who what your scenario is. If you have a certain insurance, and you're going to this hospital and you're getting this procedure done, you should be able to find how much it's going to cost you. And I will also just clarify or add something. Obviously, this is important information, and we've made the case that in every other aspect of buying something as a consumer, you know what the price is before you get your bill. But of course, healthcare admittedly is more complicated, is more confusing than a lot of other sectors in our economy. But we've also seen a lot of developments in other folks, third parties, actually taking this data and putting it into very digestible, user-friendly format. So if you think about buying a flight to go on vacation, you typically are not going to search for that for what the best flight is by looking at 12 different airlines and searching individually. You're going to go to Kayak or Google Flights or something like that, and it's going to actually do all of that work for you and spit out what the best price is or the best care or whatever it is that the factor is you're considering. So I just want to remind the committee that the data is the fundamental building block that this bill will help unlock. But the result actually that we're hoping for is that consumers will be able to use tools that are going to be developed in the future that turns this data into something that's very usable, digestible for a consumer, which then we hope will lead to downward pressure by creating more competition.
Thank you so much for the clarification.
Thank you. I have an additional question. I know that you said it during your presentation, Mr. Speaker, but would you just remind me, when was this original federal law passed requesting hospitals to disclose this information?
Steve Yeager for the record. Thank you, Chair. So 2019, President Trump issued an executive order that laid the foundation for this. So that was 2019. Those requirements became enforceable as of July 1, 2022. And then just most recently in just last month, in February 25th, 2025, there was a new executive order, I think, to reinforce the rules and add some additional enforcement. So, when faced with the opportunity to scale back, which, as we all know, our federal government is scaling back on a lot of things right now. When faced with that opportunity, President Trump did not do that. In fact, he doubled down on the price transparency. So it's been around for a while and was recently reinforced as being good law, essentially, through executive order.
Thank you. And then I believe you also stated that 30% of hospitals in Nevada are currently in compliance with this recommendation. Is that correct?
Steve Yeager for the record. Thank you, Chair. We have 35% that are in full compliance. We did submit some exhibits to Nellis that you should be able to look at. And so there are some hospitals that are partially in compliance. So 35% is just everyone who is getting an A+ right now. But the spectrum range is probably all the way from A+ to failing. And so we hope we can close that gap with some who are getting there, but not providing maybe all the information or not providing it in an understandable, digestible way.
Thank you. And then one final question. It looks like the reporting on this will be done from the department to the Legislative Counsel Bureau. So will that look like an audit report that we receive here at the legislature biennially? Will it come through perhaps Leg Commission? Do you imagine interim finance? Any idea how we would see that report as it comes from LCB?
Steve Yeager for the record. My guess is the report we made to LCB, and then it'll probably be distributed to us like we get the audit reports that happen now. Certainly, we can do one of two things. If we want to be more specific in the bill, we can do that, or if we want to just sort of talk internally to our LCB folks here and let them know how we would like to receive that. But I think that would be the idea, that it'd likely be distributed to all members like the audit reports now, which I know all of you read in great detail.
Thank you, sir. Any other questions from members? No, thank you. So at this time, Speaker Mr. Volk will ask you to step back from the table. We will now open up testimony in support of Assembly Bill 343. If you are here in support of Assembly Bill 343, please come forward and fill in the chairs. I will remind you 2 minutes. We're going to take a total of 20 minutes in support, 20 minutes in opposition, and 20 minutes in neutral. Please state and spell your name for the record. If you are a ditto, you are always welcome to say that as well. You may begin when you're ready. Thank you.
Kaylin Cardavani, Kaylyn Kardavani, on behalf of New Day, Nevada. We support AB 343 and hospital price transparency. Nevada patients and families should have the right to see what something costs and make an informed decision before they are potentially subjected to mountains of medical debt and random bills. Nevadans deserve to have the ability to make the best decision for their health and finances, and AB 343 takes that important step. Thank you.
Good morning, Chair Brownmay and Vice Chair Nguyen and member of the committees. My name is Dr. Hito Norhatan. For the record, it is spelled Hitonorhatan. Currently, I'm a stage 3 cancer patient residing in Reno. I'm here today to speak in strong support of the Assembly Bill 343 because for a patient like me, healthcare pricing transparency is not just a policy issue, it is a matter of survival. I have been hospitalized multiple times due to complications from my cancer. But the greatest shock I experienced was not from the cancer itself or the treatment. It was the hospital bill. At that amount to about $117,000. And when I look at the detail of the bill, many of them are very vague, unclear, and unrecognizable. As I'm fighting for my life, battling cancer, I think it's not fair for a patient like me and many others to have to worry about all of the details of our healthcare. So, and therefore, I would like to request that the committee members to support this bill, to stand for patients like me and families, to make sure that hospitals are accountable for price transparency. Thank you so much for listening to my stories.
Thank you. Thank you for sharing your story.
Good afternoon, Chair and members of the committee. For the record, Tess Opferman here on behalf of the Nevada Women's Lobby. We all are aware of how outrageous medical costs are becoming and have been in the United States. We need to do something significant to address healthcare costs. We need to have some level of transparency. This bill is a critical step towards that. I thank the Assembly member for bringing this forward. We simply must act in some way. Every session we discuss it, every session we know that healthcare costs are a problem. I encourage you to pass this bill so that we can have some level of transparency for patients. Thank you.
Hello, Chair Brown-May and members of the committee. My name is Carissa Pierce, CARISSAPEARCE, and I am here representing the Children's Advocacy Alliance. CAA is an independent voice for Nevada's children with a mission to ensure that every child in Nevada thrives. And I'm here to speak in support of AB 343 to enforce transparency of healthcare costs in hospitals. Cost transparency helps families make informed decisions about their care and about their children's care, and alleviates some of that anxiety that we've already heard about today associated with accessing healthcare, and particularly related to the fear of the receiving a medical bill weeks after receiving treatment that is more costly than what was expected or initially presented. So we strongly support this bill as an opportunity to provide cost transparency, and thank you for the opportunity to provide comment.
Chair Brown-May, members of the committee, Jonathan Norman, NORMAN, Nevada Coalition of Legal Service Providers. Transparency, cause of action, and banning collection when a hospital is out of compliance are things that legal aid is generally going to always be supportive of, and we are in this bill. I'll ditto the comments of the people that came before me, and to Vice Chair Nguyen's question on that section about credit reporting. You know, the hospitals would be the furnishers or their designees, the collection agencies to those credit reporting agencies, and if they would have the obligation to correct those credit reports, and if they didn't, they would expose themselves to additional litigation under federal law. So I think where it says order any reporting agency, it's really ordering the furnisher of the credit to correct the credit report. Thank you.
Is there anyone else here in Carson City in support of Assembly Bill 343? I know that we do also have 2 overflow rooms, so if you are in one of those overflow rooms and you would like to offer testimony in support of this measure, please come on up. Okay, seeing no movement here in Carson City, and we will welcome you if you are running up the stairs right now. There's no one, I see no one come forward in Las Vegas. If you are here in support, please come forward. Okay, AVH, is there anyone on the telephone line in support of AB 343?
If you would like to testify in support of Assembly Bill 343, please press star 9 now to take your place in the queue. Again, if you would like to testify in support of Assembly Bill 343, please press star 9 now.
Hello, committee members. My name is Paula Luna, Paula-Luna, and I'm the Deputy Director with Battleborn Progress. Medical costs are outrageous, and transparency in medical costs is the minimum we can do to set Nevadans to make the most informed decision during those difficult times. I want to ditto what has already been said by the previous speakers, and I want to thank Speaker Yeager for bringing AB 343 and urge this committee to support. Thank you so much.
Caller with the last 3 digits, 447. You are unmuted and may begin.
Yes, hello, good afternoon. Can you hear me?
We can, go ahead.
All right, good afternoon, Madam Chair, committee members. My name is Marnie Carey, M-A-R-N-I-C-A-R-E-Y. I'm president of Power to the Patients, a national nonpartisan advocacy group working to make sure patients in Nevada and nationwide realize the right to know the price of their health care before they get it. Healthcare is the only industry where consumers don't know the price of their services until they get the bill and basically are paying up front with a blank check. As a result, over 100 million Americans are in significant medical debt, and it is the leading cause of bankruptcy. As a national advocate for an issue that 90% of Americans support, I've testified for other states passing these laws, and I just want to run through a few of the arguments the hospitals, which universally oppose these transparency laws, tend to put out. You know, one, they say we have a federal rule. Well, we don't need a state law too. And as the speaker pointed out, since the federal rule went into effect, compliance rates have been dismal, currently hovering around 20% nationally. Enforcement is also anemic. Of the thousands of non-compliant hospitals, only 17 have been fined by CMS. So a state law would provide Nevada a strong mechanism for enforcement. Another argument is, well, we've posted estimates and patients don't use them. Well, that's because estimates aren't real prices, and the fine print always says your price may vary, and it does, often widely. And the prices in machine-readable files are not often easy to access and are often posted in percentages, algorithms, and formulas. So this bill would put prices in real dollars that make the prices usable. And finally, they often say patients don't need the total price, they only care about out-of-pocket. Well, in a country where 1 in every $5 spent goes to pay for healthcare, consumers deserve to know total prices because that is the price we all pay, whether through higher taxes, higher premiums, higher cost of goods and services, or lower wages. So true transparency would reveal that the price for common procedures such as MRI, knee replacements, or C-sections can vary by as much as 30 times between hospitals.
Thank you so much for your comments. We appreciate that you've taken the time to call in. You're welcome to submit additional comments in writing if you'd like. Thank you. AVH, are there additional callers in support of AB 343?
Yes, Chair. Caller with the last 3 digits, 511. Please press star 6 to unmute your phone. You may begin.
Chair Brown-May, Vice Chair Nguyen, members of the committee, thank you for the opportunity to provide these brief remarks. My name is Aaron Plotke, A-A-R-O-N-P-L-O-T-K-E. I'm a senior policy analyst here at Families USA, a leading national nonpartisan voice for healthcare consumers. I'm here today to convey Families USA's strong support of Assembly Bill 343, which has the power to promote meaningful healthcare price transparency in Nevada by codifying a strengthened version of the federal hospital price transparency rule. This legislation could not come at a more important time as Nevadans and Americans across the country are experiencing a severe healthcare affordability crisis. While every person and family should have access to high-quality care and affordable care, nearly 60% of Nevadans report delaying or foregoing needed care due to the high cost. A leading driver of this crisis is high and rising healthcare prices, and in particular, hospital prices, which are causing millions of Americans to go into medical debt and workers losing thousands of dollars in lost wages due to rising premiums. In Nevada, hospital prices have consistently made up the largest source of healthcare spending in the state and are some of the highest in the country. Consider Las Vegas, where hospitals are charging nearly 20% more for the same care than the nation overall. And as we're seeing in Nevada and across the country, large healthcare corporations and systems have destroyed healthy competition, which has allowed them outsized market power that they then use to dramatically increase their prices year after year. Fundamentally, hospitals are able to do this because they can keep the underlying price of healthcare services hidden from public oversight and scrutiny. And despite federal transparency rules, large hospitals, including those in Nevada, have mostly subverted the federal requirements and are actively working to keep their pricings hidden. So codifying strengthened federal price transparency requirements into Nevada law, as Assembly Bill 343 does, is a crucial step to holding the healthcare system accountable for rational prices and making healthcare more affordable for all Nevadans. Thank you so much for holding this hearing, and excited to stand ready to support your essential work.
If you have recently called in and would like to testify in support of Assembly Bill 343, please press star 9 now to take your place in the queue. Chair, there are no other callers wishing to testify in support at this time.
Thank you, AVH. At this time, we'll move into opposition testimony. If you are here in opposition of Assembly Bill 343, please come forward in Carson City and in Las Vegas. Thank you. You may begin when you're ready.
Good afternoon. My name is Patrick Kelly with the Nevada Hospital Association. We support price transparency. For 2 decades, NHA has maintained a robust price transparency website. However, we oppose AB 343 because it goes far beyond federal law. AB 343 increases the cost of health care without improving access, service, or quality. AB 343 goes far beyond the federal price transparency rules and imposes rules that are overly complicated, creating potential for technical errors that can lead to class action lawsuits and excessive penalties. A hospital that is 94% compliant faces huge administrative penalties, attorney's fees, $10,000 in penalties for each debtor, and $10 million in fines, or 1% of the annual net income of the hospital. The bill focuses heavily on hospital standard charges. Few patients pay standard charges. Medicaid patients receive free care, so the price listed is irrelevant to them. Medicare rates are fixed by the government, so the standard charge has little bearing on the patient's costs. Insurance companies negotiate rates with hospitals. The amount a patient pays is based on the policy they purchased, not the standard charges listed on the website. These 3 groups account for approximately 95% of a hospital's inpatient volume. A more detailed explanation of this can be found in our letter to the committee. The bill's provisions open the door for legal exploitation. Because of the overly broad and complex requirements, it is easy for technical errors or minor oversights to occur. Hospitals are left vulnerable to class action lawsuits. Currently, CMS audits hospital compliance with transparency rules. This should remain the standard. Allowing law firms around the country to monitor compliance and interpret if the hospital is compliant opens the door to expensive and unnecessary litigation.
Thank you, Mr. Kelly. Thank you. We appreciate your comments. You're welcome to leave your written comments with the Secretary.
Thank you.
Thank you so much. Go ahead.
Thank you, Chair and members of the committee. Blaine Osborne, Nevada Rural Hospital Partners, for the record. Respectfully here in opposition today as well. The federal price transparency rules have been a burden on our smallest critical access hospitals in the state, but they are in compliance. These files are difficult to generate, maintain, and many of our hospitals have had to contract with third-party vendors in order to be in compliance. But I would encourage you to visit any of our member hospitals' websites and look at those files yourself. They're up right now, and they have been for several years now. According to their website, CMS is now running about 200 compliance checks on hospitals across the country per month. You can see all of that is publicly available. I have a list of all the compliance actions CMS has taken on hospitals in Nevada since the inception of the price transparency rules. Many of these hospitals are just getting meet requirements. Many also have warning notices, and when that occurs, they are requested to do a corrective action plan with CMS. And once they do their corrective action plan and it's approved, those warnings are closed. So I'd definitely encourage you to take a look at that list. One hospital I'm looking at, just coincidentally, is Deanie Townsend Hospital. They went through that process, and it took from January 20th, 2023 to January 3rd, 2024. Now, many of the hospitals on the list are not taking quite that long, but to think that hospitals might be out of compliance or in an investigative process for 5, 6, 7, 8 months and not being able to collect medical debt during those timeframes would be a significant burden for our member hospitals. Also, these things, when they're not in compliance, are very minor, what I would call innocent mistakes and human errors. I would not say these are willful violations. In such cases, as was mentioned previously, CMS has fined only 18 hospitals across the country that are in willful violation.
Thank you, Mr. Osborne.
Thank you. Appreciate
your comments. Thank you.
Good afternoon, Chair, members of the committee. Paul Morakin with the Vegas Chamber. First, the Chamber would like to thank the bill sponsor for taking a few moments with the Chamber yesterday regarding the bill. The Chamber's specific concerns regard to Sections 20 and 24. As many of the committee members know, the Chamber has had a longstanding position of concern regarding private right of action, increased penalties, which you will find in Section 20, and then Section 24 regarding the revocation of a license or suspension for administrative action and so forth. So that's where our concerns pertain to specifically on the bill. Again, we'd like to thank the Speaker for his time yesterday. Thank you so much.
Good afternoon. I'm Brian Reeder, speaking on behalf of the Receivables Management Association International. That's RMAI. That's a nonprofit trade association representing financial services, including banks, credit unions, non-bank lenders, collection agencies, debt buying companies, and law firms. RMAI is not opposing the intent of the bill. What we're seeking is uniformity in definitions, the definition specifically of medical debt. The Consumer Financial Protection Bureau has established a definition of medical debt. It has been adopted in some other states in their laws, and RMAI is working this session on another bill addressing medical debt, AB 204, to include the CFPB definition. So all we're asking is an amendment to this bill to include the same definition as in Assembly Bill 204. And we apologize, we got to the Speaker late on this amendment request, so unfortunately we do have to be in opposition, but we look forward to working with him. Thanks.
Thank you, Mr. Reeder. Is there anyone else in opposition here in Carson City? Seeing none, we'll move down to Las Vegas. If you are here in opposition on Assembly Bill 343, you may begin.
Good afternoon. My name is Stacy Sasso, Executive Director for the Health Services Coalition. The coalition represents 27 employer and union-sponsored self-funded health plans in Southern Nevada. Our member groups include municipalities like Clark County and City of Henderson, building trades such as electricians, plumbers, and teamsters, public safety groups like fire and police, as well as hospitality groups like MGM, Caesars Entertainment, and Culinary Health Fund, to name a few. Collectively, our groups cover just over 300,000 lives. We are here in opposition of AB 343 today. This bill harms confidential contract negotiations and drives up costs for our 300,000 members, as well as other health plans. This structure will increase healthcare costs because of litigation that has nothing to do with us, but is based on our data, further discouraging hospitals from bargaining in good faith. These transparency rules were created in 2019 from the Trump administration and became effective in 2021. Since then, compliance has improved. CMS reported 70% compliance in 2023. President Trump recently issued an executive order underscoring hospital pricing transparency compliance as a priority, stating more action is coming in May. This bill goes beyond the federal law, and we would appreciate the opportunity to continue to work with the Speaker and other groups on this legislation. Thank you.
Thank you. Is there anyone else in Las Vegas wishing to offer testimony in opposition of this measure? Okay, seeing no one else in Las Vegas. AVH, is there anyone on the telephone line in opposition of Assembly Bill 343?
If you would like to testify in opposition to Assembly Bill 343, please press *9 now to take your place in the queue. Again, if you would like to testify in opposition to Assembly Bill 343, please press star 9 now. Caller, you are unmuted and may begin.
Yes, my name is Matt Schriever. I am a small business owner in Southern Nevada. While I understand the good intentions of this bill to post-hospital pricing, there are legitimate concerns with Section 22 of this bill that go beyond that intent. Section 22 wasn't even discussed by the sponsors and expands the scope of this bill to entities beyond just price posting and expands responsibility beyond just hospitals, because Section 22 of the bill makes it applicable to a healthcare entity, which is then later broadly defined in Section 22 to mean, among other things, any entity that provides healthcare. Small groups of medical practitioners and solo practitioners that don't have large compliance departments should not be held to these stringent standards and the accompanying huge potential financial penalties. Among many exhaustive compliance requirements, Section 22 also states that a medical provider must provide an itemized statement of the medical debt, which is, quote, easy to understand. I'm not sure what easy to understand means, and vague language like that just welcomes costly litigation down the road. That is a very broad and undefined standard that will open the door for medical providers to threats of lawsuits claiming ridiculous $10,000 punitive damages or even class action lawsuits. Ultimately, healthcare costs will increase because providers will choose to enter into nuisance settlements to avoid the prolonged, costly litigation based on such vague language. Please protect healthcare providers and remove Section 22 from this bill. Thank you.
There are no other callers wishing to testify in opposition at this time.
Thank you, AVH. At this time, we'll move into neutral testimony. Is there anyone here wishing to offer comments in neutral on Assembly Bill 343 here in Carson City? Seeing no movement here. Anyone in Las Vegas? Seeing no movement in Las Vegas. AVH, is there anyone on the telephone line wishing to offer neutral testimony on Assembly Bill 343?
If you would like to testify in neutral for Assembly Bill 343, please press star 9 now to take your place in the queue. Again, if you would like to testify in neutral for Assembly Bill 343, please press star 9 now. Chair, there are no callers wishing to testify in neutral at this time.
Thank you, AVH. At this time, we'll invite our bill sponsor and presenter back up if you have closing comments.
Steve Yeager for the record. Thank you, Chair. Thank you to the committee members for hearing this. I know you have a really packed agenda. I want to thank Mr. Volk and my two phone friends on Zoom for joining us. You heard some opposition today, always willing to work on opposition to try to see if we can mitigate that. Candidly, a lot of that opposition was very late breaking yesterday, which I understand there's a lot going on in this building. We have more bills now than we normally do, so I don't take offense to that, willing to try to work with folks. But sometimes I do feel like a little bit like Sisyphus pushing this boulder up the hill when it comes to healthcare. I mean, and the bottom line is transparency is like the minimum that we should be asking for. We should probably be doing much more than that. So I think we can achieve that. And, you know, with your permission and latitude, Chair, we'll work with the opposition and try to bring this committee back some amendments to the bill and hopefully something you can support. So thank you again for your time and best of luck with the next two bills on the agenda.
Thank you. With that, we will officially close the bill hearing for Assembly Bill 343. Okay, with that, we will move into our next order of business, and I'm happy to open the bill hearing for Assembly Bill 411, which revises provisions relating to prescription drugs, and we will welcome our Majority Leader Howdigi to the table. You are welcome to begin your presentation as you're ready.
Good afternoon, Chair, Vice Chair, and members of the committee. I'm Assemblymember Sandra Howdigi, and I represent Assembly District 41. I've introduced Assembly Bill 411, a simple but powerful step towards privacy, dignity, and security for those who provide essential reproductive care. This bill allows prescription labels for medications like mifepristone and misoprostol, the medications used in medication abortion and miscarriage management, to display the name of the healthcare practice rather than the prescribing provider. This bill is not merely a policy proposal. It is a necessary step to ensure that our healthcare providers can offer essential services without fear. In recent years, there has been a concerted effort in various states to restrict access to abortion services, particularly targeting medication abortions, which account for approximately 63% of all abortions in the United States. States such as Texas and Louisiana have enacted laws that not only ban abortion after a certain gestational period, but also impose severe penalties on healthcare providers who prescribe abortion-inducing medications. These restrictive measures have created a climate of fear among healthcare practitioners, discouraging them from providing necessary care and consequently limiting access for patients seeking safe and legal reproductive care. Nevada is not alone in recognizing the need for protective legislation. Several states have enacted SHIELD laws to protect providers and patients from out-of-state investigations and prosecutions. As of April 2024, 18 states and Washington, D.C. have such statutes on the books. And 8 states, New York, Maine, California, Colorado, Massachusetts, Rhode Island, Vermont, and Washington, have expanded SHIELD laws to protect telemedicine, abortion, and miscarriage management. New York enacted a law immediately after Louisiana indicted Dr. Margaret Carpenter from New York on criminal charges, whose name was found on a prescription bottle in Louisiana. Louisiana has a near total abortion ban. Physicians in Louisiana convicted of performing abortions, including with pills, face up to 15 years in prison, $200,000 in fines, and are at risk of losing their license. These laws serve as a testament to the growing recognition of the need to protect reproductive health care services and those who provide them. With your permission, Chair, I would like to walk the committee through the bill. This bill makes changes to NRS 639.2801, Section 1, Sub 3, to say that upon request from a prescribing provider, the label for a prescription for mifepristone or misoprostol must instead include the name of the healthcare practice. Chair, I want to make clear that this bill does not change the law on medication abortions in the state of Nevada. It also does not change who can prescribe this care, and it does not change patient rights. What it does is make sure that healthcare providers can do their job without fear, and that the patients can receive the care they need without stigma or obstructions. Before we go to questions, Chair, I do want to note that I am working with some of our national pharmacy providers on an amendment. I do not have an amendment to present at the moment because we have not agreed on language, but I did want to let the committee know that there would be an amendment possibly coming to the bill. Chair, I now am ready for questions.
Thank you. Thank you very much. Members, are there any questions? Assemblymember Koenig.
Thank you, Chair. So you just mentioned that there may be an amendment coming, but you didn't say what that amendment might be. Could you maybe tell us what that potential amendment might be?
We're looking closely at
Your microphone and your name, if you don't mind.
Assembly Member Sandra Howdigi for the record. Thank you, Assembly Member Koenig, for the question. I am working with our national providers to get language right. What we don't want to happen is have this bill pass and have an adverse effect on Nevadans or people from out of state who come to Nevada on being able to access these drugs. So we're making sure we're working on the language to make sure that it doesn't have an adverse effect and instead have pharmacies make these drugs not available in the state of Nevada.
Thank you.
Members, any other questions? No, seeing no other questions. I thank you so much for your presentation. You can go ahead and step back, and we will now open up testimony in support of Assembly Bill 411. Again, we do have 2 overflow rooms. If you are in one of the overflow rooms and you would like to come and offer testimony in support of Assembly Bill 411. Please fill in the chairs here. Also in Las Vegas. Again, we will have 2 minutes per person. We're limiting testimony to 20 minutes in support, 20 minutes in opposition, and 20 minutes in neutral, just so that we can make sure we get through the business of the committee. You may begin when you're ready.
Thank you. Thank you to Assembly Member Jauregui, and thank you to the committee members for hearing the bill. Denise Lopez for the record. Given the political sensitive nature of mifepristone and misoprostol, this change would reduce the risk of targeted harassment and violence against individual healthcare providers, and so that's why we're here in support of that. Thank you.
Hello, Caroline Mello Robertson, Caroline Mello Roberson. I am a lobbyist with Planned Parenthood Votes Nevada, here to register our support and thank the Assemblywoman Jauregui for bringing forward this important legislation. Unfortunately, we are living in times where it is dangerous to provide health care, and I love living in a state that believes in reproductive freedom, and you all, the majority of you at least, believe in that too. And so we are very happy to have more legislation that actually protects and supports the ability for folks to access care that is health care and is critically necessary. Thank you.
Good afternoon, Chair May, Vice Chair Nguyen, and members of the Assembly Health and Human Services Committee. My name is Jacqueline Nguyen, Nguyen, and I represent the Nevada State Medical Association, the oldest and largest organization representing physicians in our state. We thank Majority Leader Jauregui for bringing forth this bill and feel it is important to help protect the safety of prescribing physicians delivering legally recognized medical care. Therefore, we're in support of AB 411. Thank you.
Good afternoon, committee. Tess Opferman here on behalf of the Nevada Women's Lobby. We spoke this morning about protecting healthcare workers who are providing reproductive health care. This afternoon, we're speaking on a different bill, and we thank the Assembly member for bringing it forward. But we are in full support of anything that will protect women's rights to and people's rights to reproductive health care and protect practitioners. Thank you.
Good afternoon, Chair. For the record, my name is Robert Purdy, Robert Purdy. I'm with Silver State Government Relations, and I'm here on testifying in support on behalf of the Nevada section of the American College of Obstetricians and Gynecologists, as well as the Nevada Advanced Practice Registered Nurse Association. We just want to ditto the comments that are put before us and thank the Majority Leader for putting this bill forward. We're in very politically tense times. And we're a state that is in need of healthcare workers, and we want to make sure that we can make it as easy for them to do their jobs as possible. So thank you very much.
Good afternoon, committee. My name is Emmy Miranda, Emymiranda, Housing Justice Organizer with Make the Road Nevada. I support Bill AB 411 because it protects healthcare providers and ensures patients can access essential medication without fear or stigma. This bill offers a simple fix, allowing the healthcare practice name instead of personal names while keeping all other labeling requirements intact. This costs nothing, but provides crucial protection for providers. I urge you to pass AB 411 because protecting providers means protecting patients. Thank you for your time.
Marco Rauda, Marco Rauda with Americans for Contraception, and I just want to ditto everything that everybody in support said, and just want to thank the body and for listening to the bill, and thank the sponsor for bringing it up. Thank you.
Hi, Macy Haverda, Macyhaverda, and I'm here with the Wild West Access Fund. We're an abortion fund. I don't have anything really exciting to offer on top of that, just that we're also in support. Thank you.
Thank you. Is there anyone else here in Carson City who would like to offer testimony in support of Assembly Bill 411? Seeing no additional movement, no one in Las Vegas at the table. AVH, is there anyone on the telephone lines in support of Assembly Bill 411?
If you would like to testify in support of Assembly Bill 411, please press star 9 now to take your place in the queue. Again, if you would like to testify in support to Assembly Bill 411, please press star 9 now. Chair, there are no callers wishing to testify in support at this time.
Thank you, AVH. At this time, we'll move into opposition testimony. If you are here in opposition of Assembly Bill 411, please come forward and fill in the chairs. You are welcome to begin. State and spell your name for the record. You'll have 2 minutes.
Good afternoon, Assembly members. Melissa Clement, Nevada Rights to Life, urging you to vote no on AB 411, MELISSA-CLEMENT. AB 411 creates a special class of doctor in a most dangerous way. Mifepristone and misoprostol make up the two-pill regimen known colloquially as the abortion pill. This is not morning after pills or emergency contraception. The first pill starves an unborn baby in the womb. The second pill, taken 24 to 48 hours later, ejects the dead unborn baby. This regimen should not be taken after 10 weeks or so of pregnancy. Women should receive an ultrasound before taking the first pill to make sure there is not an ectopic pregnancy, as that would be incredibly dangerous for the mother. After the medical abortion is completed, there should be another ultrasound to ensure that all of the unborn baby and placenta have been delivered to avoid sepsis. Many of the tragic maternal deaths highlighted in the last election were caused by abortion pills used incorrectly. This is a painful and bloody process for the mom. Sadly, some unethical healthcare providers have counseled women if they have too much bleeding, they should refrain from telling emergency providers that they took the abortion pills, encouraging women to say it is a miscarriage. This bill is in the same vein. When seconds count, emergency providers shouldn't have to go through a healthcare practice phone tree to figure out what doctor prescribed the pills. AB 411 protects doctors at the risk of women's health and even lives. This is about the privacy of the doctor, not the woman. Like many of the bills seen under the guise of women's health this session, women's health, and in this case, privacy, is not of concern. Please vote no for AB 411. Thanks so much.
Crystal Manera Alvis for the record, KRYSTALMINERA-ALVIS, urging you to vote no on AB 411. It has always been said abortion should be between a woman and her doctor. If AB 411 is passed, then we won't even know who that doctor is, and in cases of a medical emergency, this is detrimental. The abortion pill, a highly dangerous prescription, which according to its own labeling, 1 in 25 women who take the abortion pill will require emergency medical care. This is an alarming statistic and underscores the inherent risks of the two-pill regimen. There would be no other prescription drug that would hold this rule to remove a doctor's name from its label, making safeguards especially critical for women taking these pills. Yet, AB 411 eliminates accountability for doctors prescribing the abortion pill, shielding them from the liability even in cases of misuse, inadequate care, or lack of proper follow-up. In the case of an emergency, having the prescribing doctor's name on a label can save valuable time and lives. AB 411 removes vital safeguards, leaving women vulnerable in emergencies while every second counts. Incorrect use of abortion pills has already contributed to maternal deaths, as highlighted in the last election. Emergency providers should not face obstacles in identifying the prescribing doctor when every second matters. AB 411 protects doctors at the expense of women, creating unnecessary risks and jeopardizing lives. For these reasons, I urge you to vote no on AB 411. Thank you.
Madam Chair and Committee, my name is Lynn Chapman, LYNNCHAPMAN, and I'm the State Treasurer of the Independent American Party. Why only these drugs? What about opioids or tranquilizers? Can the doctors hide their names on those prescriptions? Excuse me. What if some health problems arise? How long would it take to find the correct doctor to help the woman in trouble? I looked into my insurance book, and Pinnacle Healthcare has hundreds of facilities around the state, hundreds of doctors. How would they find the right doctor in time to save a life? They may not. So I ask, please vote no on AB 411. Thank you.
Madam Chair, members of the committee, my name is Janine Hansen. I'm the state president of Nevada Families for Freedom. We've seen a lot of these kinds of bills. I just ask, what about transparency? I guess it only applies occasionally, but not all the time. One of the things we have as a principle in our constitutional government is that under the law, equal means that everyone, regardless of their background characteristics, should be treated in the same and have the same rights and protections. So this once again carves out a special group of people who don't have equal rights, but more than equal rights. This principle is often referred to as the equal protection under the laws enshrined in the 14th Amendment of the Constitution. The principle of equal protection is fundamental to a just and fair society, ensuring that everyone is treated with dignity and respect under the law. One more time, some people under this bill will be more equal than others, and the sad thing about it is that some women's health and lives will be jeopardized because we don't know the name of the doctor.
Good afternoon, Chair and committee members. My name is Jim DeGraffenreid, JimDeGraffenreid. I'm Nevada's Republican National Committeeman here today in opposition to AB 411 on behalf of the Nevada Republican Party. Referring to the example given of out-of-state prosecution of a prescribing provider, it appears that the bill seeks to allow Nevada providers to prescribe medications in other states where abortion laws may be more restrictive than they are in Nevada. The people of Nevada have chosen to enshrine very liberal abortion laws into statute. We believe that other states should have the ability to decide their own laws on abortion, just as Nevada has, without interference from Nevada. We also believe that it's important that the name of the providing physician is listed on the prescription for patient protection. For these reasons, we oppose AB 411. Thank you.
Thank you. Is there anyone else here in Carson City in opposition of Assembly Bill 411? Seeing no movement, we'll move down to Las Vegas. You may state and spell your name for the record when you're ready.
Thank you to the chair and the committee. My name is Jill Douglas, Douglass. I'm speaking today in opposition to AB 411. I believe that this bill is unnecessary and perhaps deceptive and not in the best interest of the reproductive health of women in Nevada. To the best of my knowledge, I know of no targeted harassment of healthcare providers. What we should be concerned with is how this medication is dispensed and the lack of information provided. We must advocate on behalf of women and who would take these medications without proper information being provided. Cloaking a doctor's name could endanger the health of the women when they would need to be searching for that information in order to possibly get follow-up additional help. And so for these reasons, I think that as with all prescriptions, doctors' names should be on the prescription. I thank you for your consideration and ask you to vote no on AB 11. Thank you.
Thank you. Is there anyone else in Las Vegas in opposition of Assembly Bill 411? Seeing no one else, ABH will move to the telephone lines. Is there anyone on the telephone in opposition of Assembly Bill 411?
If you would like to testify in opposition to Assembly Bill 411, please press star 9 now to take your place in the queue. Again, if you would like to testify in opposition to Assembly Bill 411, please press star 9 now.
Hi, Yolanda Knock, Yolanda, last name Knaak. I'm a retired registered nurse and have to say so many times patient is having side effects. I pick up the prescription bottle to call the doctor and doctor's name is not going to be there. That is totally unacceptable. And I also agree with what pretty much everyone has said opposing 411 already. And so please vote no on 411. Thank you.
Hello, my name is Michael Ryan, Michaelryan. I want to ditto earlier comments in opposition to AB 411. Please vote no on this bill. Thank you.
Hello, my name is Christiane Mersch, last name Mersch. On behalf of Nevada Right to Life, I'm also here in opposition of AB 411. The abortion bill is not safe. While a lot of advocates are here saying that it's safe, it's not effective method of abortion. There's a lot of women that don't follow the guidelines and they have dangers. They're bleeding to death. We had a case of a teenager in Paramount that died. We need more accountability for these providers. We have cases of infection, hemorrhage, ectopic pregnancy. If a woman doesn't know that she's experiencing an ectopic pregnancy, she's in danger. So we should have more exams on her before providing these pills. Also, the psychological effects that is impacting these ladies. And as a minister, I've been counseling a lot of women that are taking this abortion pill. They are traumatic. They have a lot of stress and depression because what they saw in their toilet, it's their baby. And they're literally doing this and harming themselves, and it's traumatic for them. They need a lot of counseling. And I witnessed so many women that regretted having those abortion pills. Please vote no on this deadly pill. Thank you so much.
Hi, my name is Grace Trujillo. Can you hear me? Hello?
We can. Go ahead.
All right. My name is Grace Trujillo, and I'm a traveling nurse evangelist. And I wanted to say my concern about this bill because and I oppose it because it reduces accountability. Eliminating the practitioner's name could obscure responsibility. Also, transparency issues, lack of practitioner identification. Labels hinders patients' ability to verify their prescription. Public health risk. For medications with significant side effects, it reduces traceability. Overall, it could shift the balance between patient privacy and provider accountability, potentially benefiting those seeking discrete reproductive health services while raising concerns about oversight. This is not just affecting the people who are for our life affirming, but also those who are for it. So I believe we should be focused on protecting the patient, do no harm, rather than just the provider. We should be more transparent so we can earn trust from the consumers and we can have a direct cohabitation and right in with between them. So I really oppose this, and I concur with other colleagues that state otherwise. Thank you.
If you have recently called in and would like to testify in opposition to Assembly Bill 411, please press star 9 now to take your place in the queue.
Hi, my name is Elishaba Delote, Delote. On behalf of TNE, Traveling Nurse Evangelist, I'm speaking against this bill 411 because I believe it raises concerns about its potential to compromise the transparency and the accountability in the prescription drug process. By this, it allows certain prescription labels to omit the prescribing practitioner's name, and the bill could reduce the clarity for patients. Like me as a nurse, I would like to advocate for this patient. It's supposed to be speaking for all patients. And why are we so hell-bent in covering up for this health practitioner instead of focusing on the number one priority is patients, because all of us will one day become patients. And this is endangering the transparency and the clarity of how do we provide quality healthcare. So this is in questions right now. This can lead to a lot of confusion or misuse. This can also hinders the efforts to ensure patient safety. And I agree to all of the ones who already spoke against this bill already. Please, I am asking and begging to for everyone in the committee to just look into, their conscience and to vote against this, because this is for the rights of everyone to know what they're about to get, especially for the patients who are taking this. Please consider. Thank you, members of the committee.
Chair, there are no other callers wishing to testify in opposition at this time.
Thank you, AVH. At this time, we'll move into neutral testimony. Is there anyone here who would like to offer testimony in neutral on Assembly Bill 411? Seeing no movement here in Carson City and no movement in Las Vegas. AVH, is there anyone on the telephone line who would like to offer testimony in neutral on Assembly Bill 411?
If you would like to testify in neutral for Assembly Bill 411, please press star 9 now to take your place in the queue. Again, if you would like to testify in neutral on Assembly Bill 411, please press star 9 now. Chair, there are no callers wishing to testify in neutral at this time.
Thank you, AVH. At this time, we'll invite our bill sponsor back up for closing comments.
Thank you, Committee Chair. I would like to come up to return your pen and to thank the committee for hearing the bill. You know, with the healthcare providers shortage and access to reproductive health care at risk, that's the reason for bringing this bill, to make sure that we're protecting access and making Nevada a place where providers feel safe and would like to come and practice. So thank you, committee, and thank you, Chair.
Thank you. At this time, we will officially close the hearing on Assembly Bill 411. Next up on our agenda, members, I'm happy to open the bill hearing for Assembly Bill 176, which revises provisions relating to reproductive health care, and welcome the sponsor of the bill, Assemblymember Torres Fawcett, to the table and her team. You are welcome to begin when you're ready. As we start, I will remind presenters we're asking for a 15-minute presentation max, and then we will hold our testimony to 20 minutes in support, 20 minutes in opposition, and 20 minutes in neutral. Thank you so much. You can begin when you are ready.
Thank you, Chair Brown-May and members of the committee. For the record, I am Assemblymember Selena Torres Fawcett, and I proudly represent Assembly District 3 in the heart of Las Vegas, Nevada. I am happy to be here to introduce Assembly Bill 176, which in short establishes the Right to Contraception Act. Before I begin, I would like to introduce my intern from the University of Nevada, Reno, go Pack, Gabriela Dietrich, and I know that Marco Rauda from Alfaro Consulting is likely going to help us with some of the questions later on this afternoon. The legislature has taken several important steps in previous legislative sessions to protect and expand access to contraception. This includes SB 190, which we passed in 2021, which allowed pharmacists to dispense contraceptives, SB 161, which we passed in the 2023 session, which expanded access to menstrual products and required reimbursement to pharmacists for contraceptive services, and required health insurers to demonstrate their capacity to adequately deliver family planning services, and SB 280 of the 2023 session, which required hospitals to provide for the insertion or injection of certain long-acting reversible contraception if requested by a patient giving birth. For those of us who were in the building in 2023, this bill may be very familiar, and that's because this is a condensed version from the provisions of AB 383 that was passed in the 82nd session, which was vetoed by Governor Lombardo. Unfortunately, the issue of reproductive access is just as pressing, if not more, 2 years later. I will now turn it over to Ms. Dietrich, who will provide some additional background information to this committee regarding the governor's veto message and explain how AB 176, as amended, can remedy those concerns and solidify the intent of the bill. Thank you.
Hello, as mentioned, I am Gabriela Dietrich, a legislative intern. That is Gabriella, Gabriella, Dietrich, Detrick, for the record. In his veto message, the governor outlines two primary concerns. The first, that the bill would place any control over reproductive issues into the hands of the state policymakers, which, quote, unnecessarily restricts local officials' autonomy, end quote. And the second, that the bill would likely, quote, expose government agencies and healthcare providers to costly litigation, end quote. We will start with the first concern. While the governor argues that this bill infringes upon the autonomy of municipal governments, a lack of statewide framework creates a lack of cohesion in statewide reproductive health care policy. This may contribute to inequity between geographic regions and difficulty for healthcare providers, which may be limited in their capacity to offer consistent care in the face of conflicting local regulations. A state-level approach ensures more comprehensive and equitable policy decisions in reproductive health care. In the veto memo, the governor proposes the example that this bill could, quote, prohibit a local school district from creating a policy restricting a school nurse from providing abortion counseling and referral services, end quote. Now, let it be clear that the focus of AB 176 is to eliminate burdens on healthcare providers and patients. It is not intended to change the obligations of schools. The conceptual amendment for AB 176 will clarify this clear distinction. Further, we do not find increased litigation concerns to be a justifiable barrier in streamlining contraception accessibility. In fact, there is a higher likelihood of legal uncertainty when there are conflicting interpretations of reproductive rights across different jurisdictions because of inconsistent policies. While laws consistently face legal challenges, that does not mean that they should be abandoned. Creating pathways for litigation can strengthen protections for patients and healthcare providers alike by establishing clear legal precedents and reinforcing the rights at stake. Therefore, a consistent statewide policy reduces ambiguity, ensuring that contraception remains accessible and reproductive health care remains protected in the instability of the current political climate. Thank you.
Thank you, Ms. Dietrich. Assemblymember Selena Torres-Fawcett for the record. Before I provide you a walkthrough of this bill, I just want to make it clear what this bill does not do. And the intent of this bill was never to include abortion. That was just inadvertently left out when I made the request because we included the title reproductive health care. So I just want to make it clear that there will be, in addition to the conceptual amendment that has been provided to you all today, the definition of reproductive health care will clearly eliminate the word abortion. This is purely to protect the other items which are actually listed in the bill that I will begin to walk through today. If the chair would, Section 2 of the piece of legislation states that the contents of this bill may be cited as the Right to Contraception Act. Section 3 through 6 establish the definitions applicable to this bill. As you'll note in those definitions, the term reproductive health care does state, that it means medical, surgical, counseling, or referral services relating to human reproductive system, including without limitation, services relating to pregnancy, contraception, miscarriage, in vitro fertilization, or any other procedure. I just want to be very clear that that this section will be amended to eliminate anything that would have to do with abortion specifically. The intent of this legislation, because I know that I've seen hundreds of emails at this point have already come in, but the intent of this legislation is to capture the right to contraception and to ensure that that is guaranteed in our state statutes. Sections 3 through 6 establish definitions. Section 4 would be amended to revise the definition of governmental entity to exclude from the definition the State Board of Education, the Department of Education, the Board of Trustees, or school district, the governing body of a charter school or university school for profoundly gifted pupils, and a public school. Therefore, the obligations of schools and school activities remains unchanged by the bill. The intent of this legislation is not to make any wide sweeping changes in regards to sex education or the principles that exist within a school or school district policies right now as it pertains to sex education. So once again, this does not impact schools, which I know was a concern that the governor had last time. So we are adding that clarification to address the governor's veto message. Section 7 applies the provisions of this act to certain state laws and all local laws and ordinances, regardless of when those laws and ordinances were passed. We are also adding to Section 7 a new provision stating that the provisions of Sections 2 through 8 of this bill do not apply to any limitation, requirement enacted or implemented by a governmental entity concerning activity that takes place at a school or part of a school or school district. Section 8 prohibits the state or local government from enacting any limitation on reproductive health care or healthcare provider that substantially burdens a provider administering or an individual receiving reproductive health care. At this time, we are ready for any questions.
Thank you for your presentation. Members, do you have any questions? Okay, there are no questions. I don't know how you did that. Congratulations. We will ask you to step back at this time, and we will open up testimony in support of Assembly Bill 176. If you are here in support of Assembly Bill 176, please come forward and fill in the chairs here in Carson City and in Las Vegas. Again, we will limit testimony 20 minutes in support, 20 minutes in opposition, 20 minutes in neutral. You have 2 minutes. Please state and spell your name for the record. You may begin when you're ready.
Good afternoon, Chair and members of the committee. My name is Riley Svensson, RYLEY-SVENDSEN, and I am the Policy Specialist with the Nevada Coalition to End Domestic and Sexual Violence. NCE-DSV convenes the statewide Economic Justice Workgroup, which brings together non-traditional violence prevention partners to advocate for increased economic equity for all Nevadans. The CDC, the Center for Disease Control and Prevention, has determined that increased economic security is one of the most effective ways to prevent violence in our communities. This unique work group has 5 priority areas in which we focus, one of them being reproductive freedom. Reproductive coercion is a common tool that people who cause harm use to trap victim survivors in relationships and limits their autonomy. Raising a family and medical appointments are extremely costly, and people who abuse exploit this to exert greater control over a victim survivor. Not being able to decide if, how, and when you become a parent too often forces individuals to stay with the perpetrator of abuse. An essential aspect of reproductive freedom is access. If a victim survivor loses access to critical health care, their risk for violence and further victimization increases. Reproductive coercion is abuse, and when we deny victim survivors the autonomy to access reproductive health care, it limits their ability to leave abusive relationships. AB 176 provides crucial protections for all Nevadans. It ensures that reproductive health care remains accessible and free from outside interference. When we limit individuals' access to make medically informed reproductive choices, those systems enable reproductive coercion to proliferate. By ensuring everyone has access to evidence-based medical care, we can create a healthier and safer Nevada. This bill is an important step in preventing violence and empowering victim survivors. We urge you to support this important bill. Thank you.
Once again, good afternoon, Chairwoman Brown-May. Thank you very much. My name is Robert Purdy, for the record, ROBERTPURDY with Silver State Government Relations. On behalf of the Nevada section of the Advanced Practice Registered Nurse Association and the American College of Obstetricians and Gynecologists, I'm going to just ditto everything that's about to be said here, that we are in support of this bill for the stopping of transmissions of sexual diseases. So thank you very much for bringing this bill forward.
Thank you, Honorable Chair and members of the committee. My name is Hallery Farini. That's Hallery, F as in Frank, ERRINI. I am the Immigrant Justice Organizer with Make the Road Nevada. I'm here to support AB 176, which is crucial for protecting access to reproductive health in Nevada, but it also which is not only used for families and individuals to plan for when they are ready to have a family, but also to treat several medical conditions we face as women. A close friend of mine faced major challenges when trying to access contraceptions for a medical condition. Due to governmental restrictions, she incurred unexpected costs and dealt with unnecessary delays, all while facing significant emotional stress. Her experience highlights the barriers many individuals face in accessing necessary care. Without clear protections, many others, such as my friend, are forced to navigate complicated systems, which can lead to delays, extra costs, emotional strain, while dealing with a severe pain that is often easy to treat with contraception. These obstacles make a difficult situation even more difficult and can negatively affect people's well-being. I urge you all to pass AB 176. It will ensure that Nevadans will have the freedom to plan for the best lifestyle that they can for their family and to treat medical conditions which are very common among people. Thank you for your time and consideration.
Chair, members of the committee, my name is Lindsay Harmon. That's LINDSEYHARMON, and I have the honor of serving as the president of Nevadans for Reproductive Freedom and the executive director for Planned Parenthood Votes Nevada. I am glad today that the sponsor has offered to clarify that this bill specifically pertains to the right to access contraceptives, and we are looking forward to that amendment. We know that the constitutional amendment to protect abortion access passed at 64% in the last election cycle. That was question 6, and again will pass in 2026. I will say that last year the Supreme Court agreed that reproductive health care included a suite of services, but we had to narrow that constitutional amendment to only impact abortion access. That's why bills like this are so important, so that we can go back and make sure that we're also protecting the access to things like contraceptives, prenatal care, miscarriage management, and IVF, which we will all be hearing more about tomorrow. So that is the impetus of a lot of this work that we're doing now, is because of the time delays in getting the initial language that we had wanted for question 6 over the goal marker. And so we had to narrow that constitutional amendment. So we're here now doing some of this work legislatively.
Good afternoon, Chair and members of the committee. For the record, my name is Karen Bastidas, Karen Bastidas. I'm a student at Rocky Meadows Community College and a member of Reproductive Freedom for All Nevada. I'm here in support of AB 176. As a student, I believe that protecting access to reproductive health care is not just a matter of right, but also of equity and well-being for everyone, including students like me. This bill ensures that reproductive health care remains accessible and free from unnecessary government interference, and protects personal medical decisions from political influence, reaffirming the right to make choices about one's own body. I urge you to pass this bill. Thank you.
Marco Rauda, MARCO, RAUDA, representing Americans for Contraception. I want to once again thank the body for listening to the bill, and also thank the sponsor for working on this bill. We not only support, but we've been working with the sponsor to get the right language and get the correct amendments in order for us to get the governor to sign this bill. So I really, we'll continue to work towards that. Just want to reiterate that this is completely about just contraception, and it has nothing to do with abortion. And we hope that we can get to all of the right amendments to be able to convince everybody in this body that and in the chambers that's what we're looking for. Thank you.
Good afternoon, Chair and Committee. I am Ashina Burke, Asheena Burke. I am here with Reproductive Freedom for All Nevada and Make It Work Nevada. As a feminine wellness worker, I see the profound effects that reproductive health access has on individuals every day. I work closely with women and people of all genders who seek guidance and support on their wellness journeys. Many come to me seeking healing from womb trauma, seeking balance and self-empowerment, and often asking for help in making informed decisions about their reproductive health. I've seen firsthand how access to contraception and reproductive health services is not just about preventing pregnancy, it's about empowering people to take control of their futures. I've worked with survivors of domestic violence, individuals who have experienced fertility struggles, and those trying to heal their womb spaces after difficult experiences. In each case, the ability to access reproductive health care freely and without interference made a world of difference. There have been moments when clients have shared with me how a lack of contraception or access to reproductive care has led to unintended pregnancies, putting their health, emotional well-being, and financial stability at risk. Others have felt trapped by restrictive policies that prevent them from making the best choices for their own bodies. As someone who's dedicated to helping people achieve wellness, I cannot stand by while others are denied the basic right to control their reproductive health. I am in support of AB 176. Thank you.
Good afternoon again. My name is Emmy Miranda, EMYMIRANDA, Housing Justice Organizer with Make the Road Nevada, and I'm here to support Bill AB 176 because everyone deserves access to contraceptions, no matter where they live, work, or how much they make. For most of my life, I suffered from unbearable menstrual cramps that left me paralyzed in pain. I missed school, work, and even meals because I physically couldn't move. I cried many times asking my family why this had to happen to me every month. Nothing helped until my doctor told me contraceptions could be a solution. Like many people, I assumed birth control was only for preventing pregnancy, but after finding the right option, my life completely changed. For the first time, I could go about my day without fear of unbearable pain. No one should have to suffer because lawmakers put up barriers to reproductive health care. This bill protects that right. I urge you to pass AB 176 because everyone deserves control over their own body, health, and future. Thank you for your time.
Good afternoon, Chair and committee members. My name is Jasmine Falcon, Jasmine Falcon. I am a public health major at the University of Nevada, Las Vegas, and currently serving as the Nevada organizing intern with Reproductive Freedom for All. I am testifying today in support of Assembly Bill 176 because as a college student, I understand the importance of addressing disparities in reproductive health, particularly for marginalized communities. I also want to emphasize that contraceptives are not only a means of preventing pregnancy, but an essential medicine for those with conditions such as PCOS and endometriosis. Expanding access to contraceptives will not only empower individuals, but also provide education on sexual health and reproductive choices. I urge you to vote yes on AB 176 to protect a fundamental aspect of reproductive freedom and everyone who needs it. Thank you.
All right. Good afternoon, Chair and members of the committee. My name is Brittany Kemp. For the record, that's BRITTANYKEMP. I am here today with Reproductive Freedom for All, as well as the State Organizing Manager for Make It Work Nevada, to support AB 176, the Right to Reproductive Health Care Act. As a person who has had access to contraception since my late teens and well into my adulthood, I know firsthand how beneficial and empowered I felt being able to take control over my sexual health. AB 176 is a bill that will continue to protect the rights of individuals to make informed decisions about their reproductive health care and remove any unnecessary burdens individuals could face due to government overreach. People should feel safe in making decisions that can impact their overall quality of life. I strongly urge the committee to support AB 176, and I thank you for your time.
Good afternoon, members of the committee. For the record, Tess Opferman here on behalf of the Nevada Women's Lobby. I am in full support of AB 176, the right to reproductive health care. We appreciate the Assembly member for bringing this forward. This is essential and straightforward legislation, and we urge your support. Thank you very much.
Good afternoon, Chair Brown-May and members of the committee. My name is Jacqueline Nguyen, Nguyen, representing the Nevada State Medical Association. And in the interest of time, I'll keep it short. We are in support of AB 176. Thank you.
Thank you. Is there anyone else here in Carson City in support of Assembly Bill 176? Seeing no movement and no one at the table in Las Vegas. ABH, is there anyone on the telephone line in support of Assembly Bill 176?
If you would like to testify in support of Assembly Bill 176, please press star 9 now to take your place in the queue. Again, if you would like to testify in support of Assembly Bill 176, please press star 9 now.
Chair, members of the committee, my name is Shelby Swartz, SHELBIE SWARTZ, and I'm the Executive Director of Battleborn Progress. But I also speak here today as a fairly new mother to an 18-month-old. Bringing a child into this world has reinforced my belief that everyone deserves the right to make their own reproductive health care decisions free from government interference. This bill protects that right, and I want to thank Assembly Member Selena Torres-Fawcett for bringing this bill forward. It ensures that no one faces unnecessary barriers to reproductive care, whether that's prenatal services, contraception, or abortion care. Healthcare decisions should be made in a doctor's office and not in a political chamber. I want to take a moment to emphasize just how critical access to birth control is, especially in the immediate postpartum period. After giving birth, a person's body needs time to heal. The risk of complications from closely spaced pregnancies, such as preterm birth, low birth weight, and maternal health complications are well documented. Yet in states where reproductive care is under attack, new mothers face obstacles in getting the contraception they need to safely plan their families. For many, the postpartum period is a time of intense physical, emotional, and financial adjustment. No one should be denied the ability to make informed choices about if and when to have another child. Birth control is essential health care, and ensuring that postpartum people and all people have access to it is not just a matter of individual autonomy, it is a matter of public health and family well-being. I want my child to grow up in a world where healthcare is a right and not a privilege, and I urge you to support this bill. Thank you.
If you have recently joined and would like to testify in support of Assembly Bill 176, please press star 9 now to take your place in the queue. Chair, there are no other callers choosing to testify in support at this time.
Thank you, ABH. At this time, we'll move into opposition. If there's anyone here in opposition of Assembly Bill 176 in Carson City, please come forward and take the table. And also in Las Vegas, if you are here in opposition, you may come forward at this time. Thank you. You may begin when you're ready.
Thank you, Madam Chair and members of the committee. Melissa Clement with Nevada Right to Life with very, very, very soft opposition to AB 176. We thank the bill sponsor for the clarification on this bill, and given her words, we register our opposition only until we can see the new language. We look forward to seeing the language and hopefully joining in support for miscarriage care, ectopic pregnancy treatment, and women's health care in general, as mentioned today. Thank you very much.
Good afternoon, Chair and Committee. I'm Jim DeGraffenreid, JIMDEGRAFFENREID. I'm Nevada's Republican National Committee man, and here today, again, in soft opposition to AB 176 at this point based on the potential amendment. Our platform states that we affirm the sanctity of life from conception to natural death and the inherent dignity of each human being. Even with the indication that Section 6 will be amended to exclude abortion, we believe that it may still greatly expand the limits of existing law. Reproductive health care will still include a long list of items that you see in the section in the bill. Pending the details of the amendment, as long as reproductive health care remains in the bill, we do urge a no vote on AB 176. We think that it should be replaced with contraception if that is indeed the intent of the bill. Thank you.
Madam Chairman, members of the committee, my name is Janine Hansen. I'm the state president of Nevada Families for Freedom. We very much appreciate the proposed amendment. We want to see what it says. We are very interested in that. I have one concern because if it still prohibits local governments from having any input on where any of these clinics might be, I think it may create a conflict. In 2023 in West Wendover, they voted 4-1 in their city council not to have a Planned Parenthood clinic in that city, and then the mayor vetoed that. It's still in limbo. They haven't got a Planned Parenthood clinic in West Wendover at this time because the local community had the right to say what they wanted. However, we know that Planned Parenthood clinics not only offer extensive contraception, but they also, many of them offer abortion clinics. So how do you separate that under the law? That's one question I have. Do you just have a clinic that has only contraception? Because it could create a conflict there for some of the communities if they are faced with whether or not to have a Planned Parenthood clinic in their community, whether or not it will indeed only be limited to contraception, or if they will allow abortion. So that's just a question that it brought to my mind when I was thinking about the clarification with the amendment. Thank you.
Mr. McLeod, will you turn your microphone on? That's okay. Thank you so much. Go right ahead.
Thank you, committee members. Thank you, Assemblymember Brown-May. Brian McLeod, it's BRIANMC, capital LEOD. I'm just a little confused. I understand the amendment to exclude abortion, but from what I understand and from simple research I'm doing, the abortion pill is a type of contraception, and if that's what we're talking about, contraception, then that's still abortion, right? So I'd just like to outline just a couple quick points in opposition to what seems like is still clear abortion. The idea isn't to oppose health care or control women, which nobody's trying to control women, but the idea is that there are two lives involved in an abortion or the elimination of a life through what's called emergency contraception from the research I've done, the abortion pill. Two go in and one comes out in this type of procedure. There's another life at stake. I just want to draw attention to the fact that there really is two lives. There's another life living inside that woman and is made in the image of God. And every single one here is made in the image of God and has inherent value simply because of that. And if we, as a state, continue to usher in these laws that are entirely against the precepts of God, we are going to find ourselves very far away from truth. It's kind of like a frog in a boiling pot sort of thing. We just, each one of these bills that pass that open up.
I'm going to interrupt you. I apologize. I want to thank you for your comments. We have limited each of our speakers to 2 minutes today.
I understand.
I thank you. Thank you for your comments. You're welcome to leave written comments with our secretary that we'll add into the record.
Thanks.
Is there anyone else here in opposition today for Assembly Bill 176? At this time, we'll move down to Las Vegas for opposition testimony. You may begin.
Thank you to the chair and the committee. My name is Jill Douglas, Douglass, and I'm here in opposition to AB 176. I do look forward to seeing the amendments, but in my opinion, as is, the bill is both unnecessary and I find it to be extremely vague. In fact, having traveled throughout the entire state of Nevada many, many times with offices throughout the state, I find that reproductive health care is available to Nevadans, and perhaps this is why 98% of concerned voters who have voiced on the Nellis site have voiced opposition to this bill. In the exhibit provided by Selena Flores, it mentions that it stops the government from making rules that make it harder to obtain care. I think that we need to clarify what is the government. Is that city, county? In fact, is it the state government? You are the state government. Nevadans, again, can in fact get care for birth control, pregnancy, fertility treatments. In fact, you can go online and you can find that there are a multitude of ways that individuals, even under the age of 16, can get care from contraceptive clinics. I am very concerned that the extreme vagueness of this bill could create a lot of litigation. Frivolous litigations and lawsuits end up being funded by taxpayers. And I worry that the bill perhaps is deceptive in what the true intent is. So in closing, I just say that this is a bad and unnecessary bill. I find that Nevadans do have full access to get health care, and nothing is interfering with doctors who provide it. I do think we need care in terms of mental health and drug and alcohol addiction. However, we do have access to reproductive health care, and taxpayers should not be funding frivolous litigation caused by bad bills. So I ask you to vote no. Thank you for your time.
Thank you. Seeing no one else in Las Vegas in opposition, AVH will move to the telephone lines. Is there anyone on the line in opposition of Assembly Bill 176?
If you would like to testify in opposition to Assembly Bill 176, please press star 9 now to take your place in the queue. Again, if you would like to testify in opposition to Assembly Bill 176, please press star 9 now.
Yes, Yolanda Knock, Yolanda, last name Knaak. I'm opposed to this bill. I have not seen the amendments, and I think it's important. that the bill say, I'm opposed to the bill because it needs to say that it does not include the abortion pill. And also, what are we talking about? Rights. Does that mean the right for the citizens to pay for their contraception? And I do want to make one comment about that man that spoke from the doctor's office. Most, 95% of all contraception doesn't actually prevent STDs. So I'm not sure what he was talking about, that this bill prevents STDs. Thank you very much.
Hello, my name is Michael Ryan, Michael-Ryan. I'm a longtime resident of Nevada and a Marine Corps veteran. At this point, I'm opposed to AB 176. However, I do look forward to seeing the amendments when they come through. This bill would force communities like Wendover to have a Planned Parenthood clinic in their city when their city council voted against it. AB 176 would mean that Nevada communities along the I-80 corridor and the border with Utah would become targeted by Planned Parenthood for abortion clinics. Please don't take away local control. Please vote no on AB 176. Thank you.
Hello, my name is Lorena Biasotti. I oppose AB 176. As a parent, I'm always especially concerned with the language unrestricted abortion. It could prevent future safeguards, which we desperately need when Nevada has a city with the highest rates of child trafficking. And I find that it erodes protections and prevents future safeguards. And I'm especially against stripping parental rights of notifications. So I believe abortion bills have already been expanded to cover so many of these terms. So I don't see why we have more bills introduced to just expand what's already been there. And I find that it is a problem. So I oppose AB 176. Thank you.
Hello, my name is Karen Kogelschatz. Last name is Kogelschatz. I'm calling as a constituent and taxpayer in the state of Nevada, and I'm in opposition of this bill, AB 176. There's 3 clear points as to why. The verbiage about unrestricted abortion is very concerning. The erosion of protections, overturning existing pro-life laws, preventing future safeguards, and also stripping parental rights. That is key. Parents should have the right first as minors, and also these potential children would be their descendants. So again, opposing AB 176. Thank you.
Hi, my name is Grace Trujillo, representing TNE, Television Evangelist. Just wanted to state my opinion that I'm against of AB 176, and I concur with other of my colleagues, those who are opposing it. This is very vague, and it removes the local control for each towns and cities, and it's just example, if you're a daycare like Sarah, give an example, then this prevents any overriding local restrictions, like putting, if somebody wants to put a reproductive health care clinic next to the daycare, they have nothing to say. And then that will be legal worse, then we have to pay over it, the tax money. What about those people who are opposing it? We're just focusing on one side. It's all one-sided bill. Safety concerns. Then now, like, it's going to be mandatory. There's no mandatory safety checks. This is very, very scary for us to just put this with a vague bill. No specific. It's a law that could shrink and silence other minorities' voice. Also, parental space. And this bill is very creepy and it's overreaching. I suggest that you guys look into this and please study more about this bill besides using your emotions or using your ideology, and make it more for the people, not for your own agenda. So I urge you to look into it and please oppose this bill. Thank you.
My name is Emily Mimnaugh, Mimanughh. I am a Nevada resident attorney and calling to testify on behalf of Pacific Justice Institute Center for Public Policy. This bill is described as a Right to Contraception Act. And first, I would like to repeat and reinforce the prior testimony in opposition to this bill. We have reviewed the conceptual amendment, and we'll watch for the yet to be published specific changes regarding abortion and the impact of this bill or non-impact on schools, school districts, and any part thereof. But I have another specific question for this bill and its sponsor, which is it's not just about contraception. If you look on the bill, specifically in Section 7, Part B, it talks about sterilization, and it says that this bill would not authorize sterilization burdens, no burden on sterilization without the consent of the patient, the informed consent of the patient. But the question I have for this committee is who is the patient, and where are parental rights in this bill? And unless this bill clarifies that we are not talking about any permission for the sterilization of a minor child without parental notice, this bill cannot be passed and would be unconstitutional. In fact, as this committee is or should be aware, the Supreme Court has recently accepted another court case to hear and is expected to reaffirm the constitutional fundamental rights of parents, and that's the Mahmoud case. And so again, if this bill does not clarify the fundamental primacy of parental rights and explicitly prohibit and outlaw sterilization of any minor child without the express consent and notification of that parent, this bill cannot be passed and is not constitutional, and we will oppose it. Thank you. Hello, this is Christiane Mersch, last name Mersch, on behalf of Nevada Right to Life again. Just waiting for the proposed amendments. We're hoping that this will be okay, given to the sponsor comments. Our Cashel is waiting for that. I want to echo and ditto what Melissa Clements said, and also my personal comment that we're seeing a high number of teenagers doing abortion, and the parents are not notified. I'm a Christian minister. I've been counseling a lot of women that regret having their abortion. So I'm just concerned that this bill is going to promote more a society that just see abortion as a solution, and a lot of these women are in pain. They're stressed. They're having depression. So we have already 24 weeks abortion in our laws, and we should not expand. A vast majority of Americans are against with late-term abortion. So I just beg for all the lawmakers to listen to the constituents, and because this is very dangerous for girls. And like I said before, I waited to see the proposal amendments. Thank you.
Chairman, thank you very much for hearing me. My name is Daniel Smith, Daniel Smith. I just want to echo what has already been said in opposition, but I find that this bill is poorly written, and even with the amendments, I just don't feel that it's going to take and pass a smell test. We have other more important bills to be looked at, heard, and voted on. So thank you for letting me share, and God bless.
Chair, there are no other callers to testify in opposition at this time.
Thank you, AVH. Okay, at this time, we will move into neutral testimony. Is there anyone here to offer testimony in neutral on Assembly Bill 176? Please come forward at this time. You're welcome to take the table here and in Las Vegas as well. You have 2 minutes. You can state and spell your name and begin when you're ready.
Thank you, Chair Brown, May, members of the committee. Adam Plain, Plain, with the Nevada Division of Insurance. I just wanted to establish a robust legislative record. We are a governmental entity under this bill. We do regulate health insurance. We wanted to clarify our understanding that not providing insurance coverage for certain items is not expressly, effectively, implicitly, or implementingly singling out reproductive health. That, to put it bluntly, unfortunately, insurance coverage for a particular service, drug, or device is not and should not be equated to access to that service, drug, or device. Just wanted to make that clear. As a bit of an aside, where there's a court case recently in the great state of Montana where their constitutional language, some folks under the age of 21, I believe, sued because their constitution prohibited impinging their freedoms, and it was determined that pollution impinged their freedoms. It's kind of an interesting interpretation. Just wanted to make sure that the history is established that there are no interesting interpretations going forward related to health insurance on this matter. Thank you.
Thank you for your comments and putting that on the record. Always wonderful to see the Division of Insurance with us. Thank you. Any other testimony in neutral on this bill, AB 176? Seeing none here in Carson City and none in Las Vegas. AVH, is there anyone on the telephone line wishing to offer testimony in neutral for Assembly Bill 176?
If you would like to testify in neutral for Assembly Bill 176, please press star 9 now to take your place in the queue. Again, if you'd like to testify in neutral, please press star 9 now.
Hi, my name is Elishiba Delote. I was trying to raise my hand earlier for the opposed, but I thank you for allowing me to speak. I will just put an enlightenment in your minds, members of the committee, to take a serious look at this bill, AB 176, because this is a concerning bill. And I feel like this is like a vending machine. Once you put the action to it, press it, it cannot return it anymore. And this is concerning because I feel like they need to be more specific, because we supposed to be allowing the rights of patients, of all the Nevadians, the citizens. And I am unfortunately putting this section neutral, but I am speaking against it because I was not able to allow time for that. I did raise my hand, but was not allowed to speak. So please, members of the committee, I am urging you to your own judgment to put people first, because you are put there for a reason, to speak for everybody, not just for everyone's one-sided agenda and one-sided that they are allowing just one voice to speak. But please, please consider not to vote for this. Thank you.
If you have recently joined and would like to testify in neutral for Assembly Bill 176, please press star 9 now. Chair, there are no callers wishing to testify in neutral at this time.
Thank you, AVH. This time we are welcome our bill sponsor back up for any closing comments.
Gabriella Dietrich for the record. According to the National Institutes of Health, I am one of 5 to 10% of women ages 18 to 44 who are a member or who are diagnosed with polycystic ovarian syndrome, or PCOS. According to the World Health Organization, as many of 70% of women who have PCOS are undiagnosed. As a member of this population, I know that for a variety of reproductive conditions, such as PCOS, contraception is the first line of defense in treatment. Now, beyond pregnancy prevention, birth control and the accessibility to contraception is a crucial aspect of reproductive health care. While in the status quo, many Nevadans have access to reproductive health care, AB 176 is a necessary step in protecting it from infringement for all Nevadans. I urge you to support.
Thank you, Assemblymember Torres Fawcett, for the record. And I just really do appreciate my intern taking the opportunity to come out and testify on this piece of legislation with me. You know, I wanted to thank Ms. Clemens with Nevada Right to Life. I think that there's probably been very few times where we're like, okay, we can actually agree on a policy and that we can find common grounds. And, you know, I took the concerns that I saw in the veto message and that I heard from last legislative session, and that's how this bill came to be. It's taking those concerns. I know in the opposition, we heard statements that this had to do with abortion. As I iterated, you know, the amendment will very clearly exclude abortion, and it will make it just very clear, and I apologize, that was inadvertently left out, and so that the amendment that I am proposing will ensure that that is excluded. Additionally, you know, this does not have to do with this counseling. I know that there was someone on the phone who said that this had to do with like school counseling and what's going on in schools. This doesn't have to do with parent notification either. This does not authorize sterilization. In fact, that's clearly indicated in the bill in section 7 sub 3B. It actually says that it does not do that. So I just want to be very clear that this has nothing to do with allowing for local governments to sterilize any population. And so ultimately, this piece of legislation is a result of a compromise and, you know, understanding some of the issues that perhaps people had expressed last time. And that's how this piece of legislation came to be. And, you know, ultimately, this piece of legislation is about protecting our access to pregnancy, our access to contraceptives, our access to treatments for miscarriages, and our access to IVF. And that's exactly what this piece of legislation does. So I urge your support of AB 176. Thank you.
Thank you. We will officially close the bill hearing for Assembly Bill 176. Members, that brings us to the last item on our agenda, which is public comment. We are happy to open public comment at this time. If you would like to offer public comment, please come forward in Carson City. Seeing no one here, no one in Las Vegas moving. AVH, is there anyone on the telephone lines who would like to offer public comment at this time?
If you would like to provide public comment, please press star 9 now to take your place in the queue.
Hello, my name is Michael Ryan. I'm a longtime resident of Nevada and a Marine Corps veteran. I had the pleasure of attending the rally on protecting women's sports on Friday, March 14th. I'm very proud of Lieutenant Governor Stavros Anthony's strong leadership and support in protecting women's sports in Nevada. Now it's your turn to do the same. Protecting women's sports is a no-brainer. You are born a biological male or a biological female. If you are blessed with God-given ability to compete in sports at a high level, then you compete against biological males or biological females based on your God-given gender. Enough of this pathetic nonsense of granting a biological male permission to compete against biological females. This is wrong. Our elected Nevada Democrat congressional representatives in Washington are on the wrong side of history. They very well may not be reelected in 2026 as a result. Don't make the same mistake. Protect women's sports. Stand up to protect women's sports in Nevada by bringing SB 112 and AB 240 to the floor for a hearing. This is what your constituents want in Nevada. This is what America wants. Thank you.
Chair, there are no other callers to provide public comment at this time.
Thank you, AVH. This time, our business for today is officially concluded. Members, we do have a scheduled meeting on Friday, although I believe it's posted still at call of the chair. I will update you as soon as we have additional information. Until then, have a wonderful evening. This meeting is adjourned.